Hey guys, I'm Julie Melton doing an interview with Andrea Simmons today. She's our nurse practitioner here at St. Jude. I'll go ahead and let her introduce herself.
I'm Andrea. I'm the nurse practitioner with the Division of Neurology here at St. Jude. I've been here for 19 years and been with neurology for about 10.
And prior to the interview, I had a chance to look over your CV, and I went over it, and you have been a nurse practitioner for a very long time.
Yes.
So it looked like as a bedside nurse, you said you were in the emergency department with your undergrad career.
Mm-hmm.
And then with your graduate studies, it looks like neurology was your original niche that you went right into, which you've really honed in on those skills.
My first job as a nurse practitioner was actually here in leukemia clinic. I didn't stay for very long, and then I went and I did neurodevelopmental follow-up on preemies at the newborn center, which I really liked.
I saw that. That was very interesting. So that was your gap in St. Jude, and then you came back. And you've been here for continuous almost 20 years.
Yeah.
So that's very impressive and a big asset to the neurology department. I'll go ahead and get started with our interview questions. Okay. And so St. Jude is very diverse. We have patients from all over the world with different backgrounds and different needs. And so it is a facility that you do have to be very versatile in. My first question is, working in a facility that requires interdisciplinary teams to collaborate has its strengths and weaknesses. What does teamwork look like to you in this setting?
So, teamwork, we have to do it every day here, just by virtue of the fact that, well, first of all, because we're a consult service, we have to communicate with the primary team. This is what we think, this is what we recommend. It's not always easy, like you say. There can be differences of opinion or differences in, management styles or preferences. However, and I'll probably go back to this a lot, at the end of the day, it's all about coming together and making the best plan for that particular patient or family unit. And I think I think we're good about that here. Is keeping the patient front and center. And knowing that the more we work together as a team, the better we work together as a team, the better it is for that patient.
Okay, so I'm hearing that even despite challenges within working with multiple entities, that regardless, the main goal is patient care and getting those services for your patients. So it sounds like you work really hard to do that.
Yeah, I think we do.
Okay, great, thank you. Next question. What challenges have you faced when working as a team? This can be in terms of different views for patient outcomes, care, personal conflicts, etc. I feel like you kind of elaborated on this a bit, talking about everyone's different background, attitudes. Do you have anything to add on that with difficulties?
Well, just in terms of, I think disagreement can be, difference of opinion can be healthy, right?
Yes.
It can
create new ideas.
It can help you come up with new ideas or help you, understand a person's way of thinking better. So I don't think disagreement or vigorous discussion is always a bad thing. But there can be times, that a team member gets, upset about something or it heads in a bad direction. And I think that doesn't happen often, but it can.
Yes.
And I think you just have to remember, again, I'll go back to it. It's not really about me or that person.
Right.
It's about that child that we're trying to
advocating for your patient.
And maybe sometimes the best thing to do in those scenarios is, if you can't de-escalate it, turn around for a minute or walk away for a minute until everybody can come back on that same page. Because I think we all will end up there, back on that same page.
I hear what you're saying. So, like you said, healthy conflict is sometimes good. It generates new ideas.
Productive.
Yeah, and if we were all on the same page, then we wouldn't create new ideas. So just kind of leaving your personal feelings to the side, just to be sure that we're advocating for
our patient. You have
to
be open to listen to other people's ideas, even if you don't think that's the way you would do it. And you may not come to their way of thinking, but I think you need to be able to listen to other people's thoughts.
Absolutely.
Yeah.
Is that something you feel like you grew on as a provider throughout your career?
Yeah, I mean, well, you know, as a new nurse practitioner, you come in and you're just kind of like a sponge, and you wanna
Soak everything up.
yeah, and I think you tend to, those things that you learn initially in your when you first take on the role, maybe stick with you, and they may not always be the best things down the line,
right.
or in the scenario that you're in. So
Okay.
yeah, you have to kind of learn to say, yeah, I can do it this way, but it might be better to do it this way.
Okay. Oh, okay. Great. Well, thank
And
you.
there can be more than one right answer. As you know.
Absolutely. Yes.
Yeah.
All right. So, like we talked about, your patients are all over the place in this hospital. They have many appointments to go to, and they have your patients have schedules that could change at any time.
Yeah.
How do you adapt your plan of care to adapt to their schedules?
So I think it's important to remember here, you can't be rigid. You have to have some flexibility. It's just unavoidable because things happen. They get tied up in another clinic, or their flights are delayed, because
Yes.
we have that aspect of it here with patients coming from all over. And I just think you have to be flexible, and you have to sometimes, not that, you know, you want to have a nice work-life balance, but sometimes if you need to do something at an inconvenient time for yourself, you might just have to do that.
Okay. Just be adaptable, be
Just
flexible
be flexible, yeah.
for the outcome
And just
of the
kind of
patient.
take it easy,
Yeah.
and just know that, yeah, you're doing it again
For the
for
patient.
that patient.
Absolutely.
And it has to be done. So,
Yes.
yeah, I just think, in brief, you just can't have everything set in stone. I mean, of course, you want to stick to your schedule as much as possible.
But be able to be fluid
Exactly.
and adaptable. Okay.
Exactly.
Wonderful. How do you manage your time in a clinic when working collaboratively with your physician? Basically, how would you know which patients to see, who he sees? Do you all have a good communication when it comes to terms of that?
So that, like, when I worked in the primary clinic as part of the primary team, that it's a lot different from this role. And it's different based on the physician. The physician probably has preferences of how they want their clinics to run and
Okay.
that type of thing. But I would say, just in brief, since we're a specialty service, a consult service, a new patient with a new problem is almost always going to have to, not that I can't go in, but they're going to have to be seen by the
So
physician.
you know that.
Yeah,
Okay.
for the most part.
Okay.
The physician's gonna want to be involved in that.
Yeah. Yeah.
The follow-ups or protocol required visits, which we have here, that might be something different than they have at other places, those, yeah, I mean.
You know that you'll be able to
I'll
see
do
those.
those. We don't sit down with neither of my physicians, we don't sit down and divide it up. And
okay.
say cause it just, like we were just discussing, the flow can be so, we don't know. how
And
it's
you
gonna go.
have been with I looked at your CV. You've been with your physician now for almost 10
Dr.
years.
Klein, yes.
So you have been able to create that relationship and understanding.
We're kind of on the same page with stuff.
Okay.
And you know, he has a way that he likes to do things, and I've learned that, and I respect that, and we kind of work well together as a team.
Wonderful.
Yeah.
Okay. Thank you. Okay. How do you keep up with your skills within your scope of practice?
So, I think that the main skill that I have to constantly be sharp with is a neuro exam skill, because I do that all the time.
Yes.
Practice it all the time. And I like to sometimes go in with if I find something on exam that I find unusual or different, I'll ask them to go, one of the physicians to go, and I want to go back and see.
And see if you see it again with them.
Is this real? How do I test this further? How do I, let's do that. So kind of just that kind of a thing. And then in terms of procedures and things like that, in this role, the only real procedure I guess I've done is Botox injections for headaches. And we don't do them all the time. I mean, it's not something we do constantly, but I feel like I do it enough that I can maintain
Your skills are competent.
Yeah.
And I can see where you're talking about with your neuro exams, because neuro is very subjective.
It can be.
And when I was a new nurse, working with neurology, sometimes I did have that self-doubt. If I found something abnormal, I would want to peek in with a neurologist as well, because as I was growing and becoming competent, I wanted to be sure that what I saw is what they saw as well, because it is a
Exactly.
subjective exam.
It is subjective, and you can see if you can have a finding, and it can be a legitimate, a real thing, but it can be inconsistent or transient, and you might see that patient the next day, and that
It's
thing you saw
completely gone.
yesterday looks different, or
Right.
it's not there anymore.
Absolutely.
So, yeah, so there's lots of
Variables.
Lots of variables for
Yes,
sure.
absolutely. Okay, thank you. As an APN, it is important to have effective professional communication skills. How do you feel like you best communicate with colleagues and patients in a professional manner? Has this ever been difficult when you have had disagreements or noticed the other person was upset?
So I think just part of well, in any medical profession, but I think here we're dealing with families many times that are under a lot of stress. It's very stressful to have a child with cancer. Many of our patients, we're seeing them because something bad has just happened.
Absolutely.
They've just had a seizure. They've just had a stroke or some sort of neurological. So we don't always get people at their
Best.
best,
Happiest.
for lack of a better
Yes.
word. And I think you just have to always keep that in mind, that if that patient or family member is, snappy with you or doesn't seem, you can't take it personally.
Okay.
I think you just have to understand that they don't know you.
Okay.
They're not mad at you, they're mad at the situation. And most of the time you can kind of
Get the
establish a good enough rapport and say, listen, we're gonna work this through, we're gonna try to figure this out, and you kind of get them on a level where they know that you're there to help, and and they'll get past that. And in terms of a coworker with a disagreement or something, kind of like I said before, if you see that person escalating, and rather than risks a confrontation and escalating yourself, I think sometimes, for me at least, it's best to just take a breath, step away for a second, turn away, and then come back, and usually we're all able to maintain. I think we're all pretty professional and
thank
have
you.
respect for each other.
Yeah, and these are all skills that are definitely built upon experience as well. The more you grow as just a person and a provider and a professional, those skills that you come in on. And what I'm hearing is just being able to see it from the patient's and the family's point of view.
For sure.
Just being able to be empathetic and know that, hey, they are going through the worst period of their life, and let me just be a helper and be a light and not take this personally.
Yeah, just be an ear and a listen.
Okay.
And be a punching bag if you need to.
Yeah. Yes. Appropriately.
Not in a literal
Yes.
sense.
Yeah.
But yeah, I mean, if they need to vent, I think that
Let them.
we have to respect that.
Okay. All right. Well, good. I mean, you're dealing with some difficult cases here, so I could see how that would be. Okay. What was your initial motivation to becoming an advanced practice nurse?
So when I was in nursing school originally, or in school, because I can remember saying, like, early on, I wanted to either be a neonatal nurse practitioner or a pediatric nurse practitioner, and I just never went the neonatal route. But my first job was at Le Bonheur, so I always kind of did peds. And what I originally wanted to do then is I was a clinical nurse specialist. That was my first master's degree. And so I did that, and I love that. But that role is kind of not really a thing anymore. That was more of a bedside, more of an inpatient. We did a lot of teaching. We did a lot of care coordination.
Okay.
So I really liked that. And I did that here for my first 2 years here. But then I still worked with the brain tumor patients. I did radonc and neuro-onc. But I got to know the nurse practitioners in neuro-onc, and I saw the relationships that they had with their patients, and I was just like, this is so cool.
Yeah. Even with your background in education, there are laws that govern your care in Tennessee, such as working directly under a physician. How has this affected you in clinical practice?
Yeah, I think that we work well with our physicians here. We work very closely with our physicians here. I enjoy working with the physicians. I learn from them. I think they learn from us. I think it's good for them because nurses and doctors don't think the same or do things the same way necessarily. So I think we benefit from each other. I feel like I have an appropriate level of autonomy.
Okay.
Yeah, I think that I mean, obviously, it's not the same as if you were in a primary care clinic seeing tons of patients. It's just the nature of what we do is different, and I think it requires a higher level of collaboration.
Okay.
And which I enjoy, and I think works well.
Okay, great. Certain states have restrictions for prescribing controlled substances. How has this affected you in prescribing medications for your patients that reside in other areas?
So it's not always a big issue, but it has been. There's some states that won't let advanced practice providers do controlled substances, and that's a lot of our medications are controlled substances because we manage the stimulants, and some of our anti-seizure medications are also controlled, so that can be excuse me, a little bit of a problem. So far I've only got one state that I absolutely can't prescribe controlled substances in, and I just have to call upon one of my physicians to do that when that arises, but
Okay.
it hasn't been a huge hindrance up to this point.
Okay.
So, but
Which state is that?
Oklahoma.
Oklahoma. Okay.
But I think part of the problem, it may become more of an issue as our procedures and change, because the vast majority of the medications I order from here and they get shipped to their patients. So there's just a few states that we're starting to introduce a program where the patient, we can call it into a local pharmacy and the patient can get it there.
Okay.
So that's when that's going to come into play. If I, as an advanced practice provider, can't do that.
Because you don't have prescribing rights within that state.
Yes.
Okay.
Yeah.
All right. Well, thank you so much for allowing me to interview you and giving me the time.
Glad to do it.
Yes, thank you so much, and thank you so much for listening.